Thank you. Once again, I'm very sorry for starting or joining this meeting a little late. I just had a couple of each. I'm glad and excited to share some of our thoughts with all our veterinary paraprofessionals all across the globe, particularly on the subject of safeguarding animal health, strategies for biosafety, biosecurity, and occupational safety in veterinary medicine. Like I've been rightly introduced, Samuel Famakinde, and it's a pleasure sharing with every one of us. I'd like to introduce this thought by talking about the fact that veterinary practice involves exposure to several infectious agents, some of which opens us up to zoonotic infections. And of course, we are equally open to various hazards in this environment and in this space. We do know that it's essential for us as veterinary professionals to safeguard ourselves against many of these possible infections and many of these hazards. You agree with me that as paraprofessionals, we will interact with several animals, with several animal owners, and we trust that millions of such we will encounter. We must stand well prepared such that we are first as individual professionals, we are safe, we are feel free from these biological issues and infections. Of course, it's also important for us to make sure that as players in the public health sector, we are there and crucial to play our role to make sure that we keep the public away from zoonotic infections and particularly infectious diseases. Crucial again to that is the fact that beyond the population and beyond our personal self, our animals, that the livestock industry that we take care of, we must make sure we don't become sources of infection transfer to them. So it's very crucial and important. So this discourse is actually aimed to look at the strategies by which we can actually work around biosafety, biosecurity, and occupational safety, of course, in the environment for us as professional colleagues, and it's important for the public health. So this presentation actually will discuss key actions to mitigate risk and enhance safety in the for us as veterinary paraprofessionals. I'd like us to understand biosafety in veterinary practice. Biosafety simply means measures that we take to prevent accidental exposure to biological agents and contamination. The measures we take as veterinary paraprofessionals are important to make sure that we are not exposed to biological agents accidentally, or we are not exposed to contamination. It's important for us to know that we work in the space where there's a high risk of contracting infectious diseases. And of course, it's important for us to assess the level of risk for each of the infectious organisms we're exposed to. Then, of course, on the issue of biosafety, is to also look at our proper handling and disposal of biological waste. You agree with me that there was this myth, I wouldn't know how factual that is, that the COVID-19 virus actually was the epidemic or the outbreak of COVID-19 infection. It was actually due to an improper disposal of this biological waste. We actually, as veterinary paraprofessionals, we have a responsibility to ourselves, to the population, to our animals, to ensure that, of course, all kind of biological waste are properly handled and properly disposed. All kind of biologicals that we work with, we take good care of them. Of course, again, is to mention that we'll be discussing about the use of personal protective equipment, PPE. This is very essential for our safety as professionals. And of course, we'll be talking about compliance to biosafety levels that are actually essential. I'd like to begin to talk about the different levels of the various biosafety levels in veterinary practice. It's been generally classified that we have 4 biosafety levels, of which it's important for us to know as veterinary professionals and important for us to work with. The first biosafety level, which is said biosafety level 1, is of minimal risk. This has to do with just exposure to organisms that are not pathogenic. Of course, you agree with me that for every one of us, there are some organisms that are ubiquitous and they are non-pathogenic. Of course, if we take a slide of our mouth, just take a swab of our mouth, you agree with me that there are certain organisms that will be cultured. And some of those organisms are actually non-pathogenic. Some of them are actually necessary for our normal flora of our body system. And some of these are our organs. The same with the animals. So, of course, exposure to some of these biosafety level 1 has to do with those organisms that are of minimal risk because they are non-pathogenic. They will not affect the overall well-being of any one of us. The second one is biosafety level 2, which is moderate risk. That's exposure to organisms like salmonella, like leptospirosis, or leptospira particularly. Of course, they are of risk because I know and you know that leptospirosis is a major cause of reproductive issues in livestock diseases, and of course in humans as well, because leptospirosis is a big issue. And you know that it's carried by, you have the major vector to be rodent, rats. So you want to do everything possible to at least manage when you are dealing with organisms like leptospirosis, like salmonella, leptospira. You know that you have moderate risk. And of course, all of this we can manage. And of course, the biosafety level 3 are the high risk infections because they are difficult to manage. They take a longer period of time to manage, and some of them are really, really very challenging. Some of those organisms and category is Brucella. A friend will say Bruce, Brucella abortus, Brucella ovis, and all of, you know that, of course, brucellosis, particularly in both in animals, is fact. You recall that when you have other cases of brucellosis, you must manage because you are in high-risk environment. You don't want such an organism to actually find its way or entry into the system of yours as a veterinary paraprofessional. That's why we don't take chances. We don't just assume when we have, some animals with swollen limbs, or you don't feel like hygroma in their leg, or you find some series of abortion in the 3rd trimester, we don't just underrate that because we know there is a potential that we might be dealing with brucellosis. That is high risk. We must take caution. Of course, Mycobacterium tuberculosis. You agree with me that in many of our habitats and as we have interactions, many animals actually that we're exposed to, they're exposed to tuberculosis, Mycobacterium tuberculosis. And you know that even in humans, if this organism affects humans, you know for sure that the process of managing tuberculosis is over 6 months in humans, the same in animals. So it's important for us to know what we still manage tuberculosis. Brucella in the animals, we just stamp out. So when you are exposed to organisms like Brucella, you know that is high risk, of course. And the BSL-4, which is the extreme risk organism like Ebola, nymph virus, which of course rare in the veterinary space, but of course we could see we've seen a few cases of that. They are high risk. As a matter of necessity, we must take caution. We must always learn to classify pathogens and follow these different levels of protocols in handling them. Because, of course, when we understand the level of risk we're exposed to, we are guided by our approach to managing such condition. I'd like to quickly speak about security in veterinary practice. Biosecurity has to do with measures to prevent the introduction and spread of infectious diseases, measures to prevent introduction of diseases, and of course the spread of disease. You agree with me that this is very essential for us as veterinary professional. Biosecurity is essential for us in our practice. We can actually cordon and manage a lot of diseases when we are able to increase our level of biosecurity. So, of course, what are the things we do in biosecurity? One, we want to control access to veterinary premises or access to our practicing premises. For example, either if you are running a farm or if you are managing a farm or you are running a paraveterinary practice, it's important that you can control how many who have access to your facility. Of course, and when any truck, any vehicle is coming to your facility, you want to disinfect them before they come. You want to make sure that you make a control. People don't care. People who are coming from a different farm or don't just walk into your facility, into your farm at ease. You encourage, as professionals, we encourage that in our practice, we make sure we have a control, not just free access. We cannot have multiple accesses to our practices. Same way, when we are consulting with our farmers, we have to encourage them that they should have a singular access where there can be control to their facility, and there they can actually disinfect and of course control, give people new PPEs, especially if there are people who must come into your practice. Put certain measures in control. The second issue in biosecurity is the issue of quarantine isolation protocols. You agree with that when you are bringing in new animals into a herd, into a farm, we don't just join them to the existing herd. Important, we make sure that such animals are set apart, quarantined for a period of time, where we will evaluate them, keep them in a separate place in an isolation pen where we observe them, take samples for evaluation in the lab to be sure that such animals are free from infectious diseases that they can transfer to other animals. Of course, and where there are infections, we will treat and manage. Be sure that such infections are curtailed and they are not transferred to the other population. Of course, like I've mentioned, in biosecurity is continuous disinfection of equipment and facilities. There are many of us that, of course, we go actually even to use the same we use some of our equipment, probably debeaking machines. You want to debeak an animal, you don't disinfect. We have to disinfect the debeaking machine. We have to disinfect our what do we call it, our scissors, all the small tools we use. After use, we are supposed to disinfect and make sure that this environment, these equipment are well kept. The same way with our facility. If you are running a veterinary practice and you have a facility, it's important that disinfection has to be a continuous thing. Not that we disinfect in the morning, we disinfect in the evening. No, it has to be a continuous. As you treat each animal, as you manage each animal, the place, your table must be disinfected with important disinfectant that are safe. Of course, also in biosecurity, we talk about vaccination and parasite control. Many diseases exist, but we can prevent by vaccines. And it's important for us to be able to administer the required vaccines as at when due. Vaccination helps us to actually secure our practice, secure our animals from infections. We're able to prevent them from catching this infection. So it's important. Of course, disinfection, parasitic control is important. Deworming is essential for us. And of course, the overall overbearing issue is client education on zoonotic disease prevention. Many of times our clients do not know. We need to let them know the potential of transferring infections from animals to humans or from humans to animals. They need to know that so that even in their day-to-day practice, they will be properly guided. At the same time, they can, as a matter of necessity, of course, prevent that when they come into our practices. A case of note is the avian influenza outbreak that was controlled by strict biosecurity all over the world, and even in Nigeria particularly. We were able to manage it by proper biosecurity, and of course, this is still essential and this is still important for us. I like to talk about occupational safety and safety risk in veterinary practice. For us, we know that as veterinarians and para-veterinarians, we know that there are major hazards that we're exposed to: biological hazards, chemical hazard, physical risk. and psychosocial risk. Let me quickly speak about biological hazard. I've mentioned some of them: brucellosis, rabies, leptospirosis, some of which are zoonotic. We are occupationally, we're open to this hazard day by day. We can contract infection. So it's important for us to actually guard ourselves against biological risk by taking normal required precautions. We don't use bare hands to just manage any case. It's important for us to know. Chemical risks such as anesthetics and disinfectants, many times they can cause burns on our skin. In fact, I've had a case in time past where a married woman who was actually 2 months pregnant, didn't know, was working particularly on some of these synchronizing agent, prostaglandin F2 alpha particularly. When this was poured a little bit on our body, and of course the skin absorbed it, unconsciously it felt that was no big deal. But of course, prostaglandins will always cause abortion whenever you have a corpus luteum. So unconsciously, the woman lost the pregnancy. This is simply because unconsciously she didn't handle these chemical hazards, these medications, these anesthetics, and disinfectant. They have a great potential to cause us certain risk that we can avoid. Of course, again, is physical risk. Animal kicks, scratches, of course, animal bite. Just recently, I was speaking with a colleague. She said, she has a wound in her. So what happened? Said she was bitten by a dog. Like, why? How did you mind? I said, I didn't know. I thought it was a friendly dog, and we're managing it. So we know that as paraprofessionals, we are exposed. Kick. There have been friends and colleagues that have been kicked by cattle, and for whatever reason, they have to manage it for a period of time. So I want to encourage us. We should guide against this. And of course, we also have the issue of being burnt out, psychosocial risk. We're so tired and fatigued. We must work against it. We need to know that studies have shown that 65% of vet professionals experience injuries from animals at some point in their careers. And as paraprofessionals, we must guide against this very, very well. I like to talk about personal protective equipment, PPE. These are some of the things we must do to guide against all kinds of risk that we can be exposed to. It's very essential for us to wear gloves, because they protect us from pathogens. We must wear face masks. They reduce inhalation of aerosols. This we all know. We must wear goggles to protect our eyes from splashes and all kinds of things. We must wear our proper gowns and boots. This is actually wear proper clothing that are smart on us to make sure that we can easily access warmth and we can prevent contamination. PPE should be properly fitted. They must be correctly used and properly disposed. Some of our boots should be properly washed and disinfected on daily basis. Our gloves should always not, we should use gloves that we can just dispose and get new ones. These are essential for us. I like to speak about zoonotic disease prevention. Key, of course, are zoonotic disease, some of which are rabies, leptospirosis, brucellosis, which we know about. Routine vaccination is one of the things we can do to actually protect ourselves from this zoonotic disease. Vaccinate our animals. Make sure the animals in our custodies are vaccinated. Our staff should also be vaccinated against rabies. Of course, this is essential for us. We should take our doses as professionals. These are preventive measures we can do. Again, we should look at hand hygiene. Proper washing and sanitation protocols must always be put in place. We must actually do a vector control. We must manage ticks and mosquitoes in our environment so that we are not exposed to carriers, to vectors of diseases around us. We must make sure there are no ticks around our premises. We must make sure that we always ensure that. Again, it's regular health monitoring for veterinary staff. This is essential. For every veterinary paraprofessional, we should go through a regular checkup of our health. These are essential. We should not make assumptions. We should not think that, oh, no big deal. Please take your health monitoring specially in place, and don't take charge of it by yourself. Go to another professional. Go to medics. Let them evaluate you. Let it be on regular basis. It's for your safety. Of course, this will help us to stay healthy and to stay out of infection. Of course, finally is the public health awareness. If we must actually guide against zoonotic disease, if we must prevent them, then the population that have pets, the population that have dogs and cats, they must be properly made aware of what is happening to them. and this must be properly handled on. Let me talk about safe handling of veterinary pharmaceutical and chemicals. I spoke to you initially. We have common hazard about anesthetic gases, of course, that have been inhaled and has created problem. A big story about antibiotic resistance is on the big move. We must make sure that we guide against these things and we properly handle antibiotics. Somebody have tried to inject an animal and injected himself before. Somebody was trying to vaccinate poultry chickens and at the time vaccinated himself. We must safeguard against all of these things. In doing all of these hormones and we must prevent by use of certain things, proper storage and labeling of chemicals. We won't make mistakes to inhale certain things when we are properly labeling them. It's also important for us to use fume hoods, fume boxes for volatile substances. They will help us to absorb them. That will be for our safety. Safe disposal following hazardous waste guidelines is also essential for us because our health is important. We must ensure we keep that up. I'd like to quickly speak about emerging preparedness in veterinary clinics. How do we guide against emergencies? That actually is the thing. Emergencies will always come. For example, we have fire outbreak. In preparing against emergencies, one, we must have certain routines we have run. I remember there was a time I was working in a clinic. We actually usually prepare for an emergency case being rushed into our facility. We simulate how we are arranged. We simulate the roles of every player within the organization. What the Dr. One will do, Dr. Do, what the nurses will do, so such that when we have any emergencies, we are prepared. We have simulated the process of emergencies and we can run for it. Of course, again, is fire safety drills and evacuation plan. Eventually, as in our practice, we should have safety areas. We should have area where we can run to. We should have procedures, and these drills should be actually run so that everyone in the facility, everyone working with us as paraprofessionals in our facility, they are aware and they can know how to do it. Again, is to know how do we handle aggressive animals. We should actually not assume all animals are going to become. We must know how to properly manage aggressive animals. We also need to have first aid boxes, first aid kits, both for our staff and our animals, because there could be bite, there could be anything. This is essential. Finally, in emergency preparedness, reporting and documentation of accident is important. When things are happening, we must always make sure that we report duly. Depending on if there is zoonotic disease or if there are reportable diseases, we must escalate to the higher level of authority. This is essential for us. I'd like to quickly speak again of a few case studies in biosecurity successes in veterinary practice. Particularly, you know, all of us are aware of FMD outbreak. This is an outbreak that we've seen time and again within our country. It's been curtailed. But of course, you agree with me that when you find a flock with FMD, particularly with the nature of particularly probably in cattle, in the nature of our herding particularly system, where we still have a lot of people who are still moving from one place to other, who are moving, they are grazing their animals probably within the grazing reserve, who are moving the animals within a particular space. These animals are open to accessing other animals, or probably where their animals have gone to drink water, where the what do we call it, some of them, the saliva from some animals has drooled, the other animals can go there and contact it. Where some of the fomite from the animals are falling, other animals go the same route and they can pick it. So importantly, how do we work biosecurity in veterinary practice, especially in the case of FMD? One is rapid quarantine. When you notice an animal that has FMD, the first thing to do is let's quarantine that particular herd of animal and restrict their movement, reduce the spread of this animal, this infection. This is essential. Again, is strict disinfection of the facility so that we prevent secondary outbreak. If we must manage and disinfect that facility to make sure that no human, no animal transmit this disease, this infection consciously or unconsciously. Again, the other issue we can do is to vaccinate. FMD now, we have a very good vaccine produced in country that which every one of us as veterinary paraprofessional, we must advise livestock owners, we must educate them on the need to vaccinate the animals against foot and mouth diseases. And of course, we want to look at how can we minimize public health impact. and minimize economic losses for farmers. It's been known that when FMD outbreak comes, it actually affects a large population of the calves. Many of them will have a high level of calf mortality. And of course, this is already a lot of reproductive wastage. This is not good for our farmers. It's important to know early intervention and biosecurity protocols are critical in disease management. And my conclusion, these are my takeaway. Final thoughts. Biosecurity measures protect veterinary staffs and animals. Biosecurity prevents disease outbreak. Occupational safety ensures a healthy work environment for all of us who are veterinary paraprofessionals, and continuous education and compliance are crucial for the population. A safe veterinary practice is a successful veterinary practice. Thank you for listening. You're welcome.